Hey everyone, it's Casey here. I'm just getting my screen set up. So just give me 1 second. We'll get it sorted. There we are. I'll share my screen. All right, I think that's okay. Just checking that everyone can hear me. Put something in the chat. I'm pretty sure my mic's working. My mic wasn't working. I think it should work. Oh, actually, I don't think it's working. Let me, you probably can hear me, but I'm not connected to my right mic. Give me 1 second. Okay, I think that should be a bit better. I'm on my better mic. Yes, looks like it's working. Sorry about that. And I'll just add a few other people in. Excellent. And I've shared my screen. I think you should all be able to see that. What I might do is just going to change my screen around 1 second. We're off to a great start. Let me share it again. Let's do this one. Window, getting there. Okay, hopefully everyone can see that. So my name's Casey. I'm a GP practice owner. I'm doing a presentation tonight on an introduction to AI receptionists. So if you've ever wondered about AI, artificial intelligence, how it'll work, how it'll change practices, this is an introductory presentation. We're going to go through a few really key principles about AI receptionists. What we're going to do is we're going to talk about how they can be implemented, things to look out for, so common, high risk scenarios. AI receptionists definitely have the potential to change a lot of what we do in general practice, but there are some really key things that we've got to keep an eye out for. So tonight I've got a couple of people that are with me that are having a chat as well, and just going to pop in and have add in some very valuable thoughts every now and then. So that's Dr. Rosemary Listings from Peter Evans Solicitors and AJ LeMay from ASAP Telecom. They're in the chat there, which I will have a look at on my other screen to make sure that there are no questions coming through. So they'll help us answer any questions, but otherwise we're going to have a discussion about how AI receptionists will work, how they're going to be changing the way that we do general practice. I think they actually have a much broader scope and a much more important scope than even AI scribes. So we're all probably familiar with AI scribes, how they work. So they're what GPs use when they consult with the patient. And I think they're actually going to make a bigger difference than even the AI scribes. So let me just pull up my chat to make sure I'm not missing any questions. So the things that we're going to cover tonight, we're going to cover up just really broadly, what is AI and how does it work? So super broad. AI receptionists, how do they work? How can I set it up? What things do I need to consider? What are some practical implementation tips? So if you've ever implemented AI scribes in your practice, you'll probably find that there are some, implementation strategies that you had to get all your GPs, nurses, etc. on board. Same sort of thing with AI scribes. We're going to talk about how we can implement it in a way that is not risk-free, but low risk, but also provides the greatest benefit and greatest utility. A few things that will follow: the 80-20 rule, so Pareto principle. How can we get an AI which is really smart, but probably still good at certain workflows than all workflows. So, general AI. How can we implement it for certain workflows, like taking and booking appointments, rescheduling, things like that, and set it up in such a way that it's very well automated, works great, patients love it, allows them to access their GPs at any time of the day, as in book an appointment, not actually access them, and ensure that they're going to have a good time. So let me pull that one up 1 second. I'm just making sure I'm not missing anything in the chat. Here we are. Excellent. There we are. And just before we start, this is all recorded, so feel free to share it. I also do have a little checklist on a worksheet. So if you wanted to have a look at things that I'd recommend checking, so checking with any AI receptionist vendors that you're engaging with, checking about implementation strategies. I've got a checklist that we'll give you that you can have a look at and sort of take home. So what is AI? So really broad. So I hope no one laughs at this too much. So essentially AI learns from patterns, predict and generate responses. You've got general AI and narrow AI. General AI is super intelligent, is pre-trained with a ton of data. Narrow AI is more of a task-specific thing. You might also use the term agent. What we're using as AI receptionists is probably more akin to a narrow AI or an agent type AI. So the way that AIs work, as a very general, very broad general term, is they get pre-trained with a ton of data. So lots of stuff off the internet. If you're familiar with Grok is XAI, or like Twitter's AI. That's pre-trained with a ton of data. Some people sort of say, is it pre-trained with Twitter data? Not 100% sure, but it's trained with data off the internet, books, libraries, etc. Then that data is fine-tuned, so to make it actually useful and usable. And then from that, conversations can develop that will make it a little bit. Let me check. Can everyone hear me on my mic? I'm just double checking. Let me just check my mic. I think I'm all good.
Yeah, I can hear you.
Yes, everyone can hear me? Good. I think should be right. Okay, good. Someone just put in the chat, I couldn't hear me. Hopefully we're all good. So let me just check here. Yes. Let me know if you can't hear me. When my mouth moves, I should be saying some words. So with these models, the more intelligent models, ChatGPT-5, the super groks, things like that, they have access to a lot more data, or they're fed with a lot more data. The reason why I put that little dot point in here is that has a relation to how fast the AI receptionist can actually answer questions. If you think of it as a more intelligent, person who draws on all of this bachelor of 10 different degrees, they might take longer to answer a question. But if the question is, do you have parking available at your general practice? Or is there a wheelchair accessible toilet or something like that? You don't really need a whole lot of data to answer that. You will give it the data. So whenever you engage with an AI receptionist, there'll be a knowledge base. It will be a knowledge base that you give it. So the same sort of manual that you train your receptionist on, that's how we do it in our practice. We have a reception manual. We've essentially given it to the AI. The AI knows when we open, knows where the parking is, knows where our toilets are, knows when our doctors are working. Some doctors only work a half day. Some doctors only work 2 days a week, 3 days a week, whatever. So we're giving it that information. So it's got most of the information that it really needs. It probably doesn't need to know about the theory of relativity and the history of Great Britain and things like that. Although if someone asked it those questions, I suppose it would come in handy. So where are we at in terms of AI in general practice? Now, AI has come a long way, and certainly AI in general practice has come a long way. You've probably heard of AI scribes. There's a ton of different AI scribes. They help write, edit notes, documentation, reports, letters. They can summarize complex information. In my practice, I use AI like ChatGPT to generate ideas, business plans, to help with marketing. Really great for social media. So what are some ideas that I can put up on Facebook? surrounding, what we do as a business. It can engage in natural conversations. You can have a conversation with ChatGPT. I was having a conversation with it earlier this afternoon saying, how exactly should I explain some of these things in this talk tonight? And it was giving me ideas, which was great. And then other things in the context of GP, aid with MBS suggestions, aid with your care plans, health assessments. Very commonly, I will put the Medicare criteria for a health assessment. So new health assessment, the 695 menopause health assessment, I just put the MBS criteria in the chat GPT, and then I say, can you create a template for this code? And it creates a template, and it'll separate it out by nurse role and the doctor role, and then that's how you can use it to create a template that's really easy to use. A great template covers all the criteria because you've given it the criteria. So AI is fantastic for doing those sort of things. So that's a relatively broad role. It pulls on a fair bit of information. We give it some information. Really great at synthesizing things. So how can we move from the AI scribes, which are great tool, great tool, but still have training wheels on them because they're in the context of usually one-on-one conversations, usually in a nice office. There's no, animals barking in the background or multiple kids crying or your phone's on loudspeaker. It's usually just, a patient, of which, yes, there could be multiple and kids involved and things like that, but also in the context of medico-legal responsibility. So when the patient is consulting with the GP is sitting right there. So if the AI scribe summarizes the consult poorly, that's okay because the GP was right there as well and listening alongside the AI scribe and can look at the notes and go, well, actually that didn't happen. The AI scribes are becoming more accurate, so hopefully that doesn't happen too much. But they've still very much got the training wheels because the GP is there, the nurse is there with the patient. Very easy to pick up on any sort of mistakes. We're moving towards AI receptionists. So AI receptionists are taking calls. Yes, they're not going to be doing, clinical conversations. It's not as if they're diagnosing patients with, diabetes and whatnot on a phone call, but they're going to be taking phone calls that ideally have very little to no clinical conversation, but possibly could have a little bit. If you've had a discussion with your human receptionist, I know that that sounds really funny to say, have a discussion with your human receptionist as opposed to your, computer receptionist. But if you talk to the real living in the flesh receptionist, they will say that, yes, we are there to book in patients, but they will give you their full life story and you need to have some form of triaging, whether this is something I need to pass on to the nurse or the doctor, or just tell them to hang up and call the ambulance because this patient's having crushing chest pain, but they want to come into the GP practice. So they will still have similar sort of difficulties as an AI receptionist would. I suppose what we're doing is we're putting a lot of trust in AI receptionists that they're going to answer the same way that we've trained our reception staff. The good thing about AI receptionists, though, with the training, is that you can do the training, you can do it really, really well, put appropriate guardrails on from that knowledge base, and then once you're done, it's pretty well done because you've told it these are the times the patients, the doctors are available, these are opening times, and it will always remember that information. We're using it for calls, booking appointments, of course, rescheduling. So why are practices exploring this? So in short, there's workforce shortages. I'm a practice owner. It can be really tricky actually to get receptionists. Getting new receptionists every couple of weeks, months, etc. There's a lot of turnover in context of just training them. There's a bit of this idea of, I call it reception fatigue. So it can be really hard being a receptionist. You're right at the coalface with the patients. The patients can be sick, demanding, even dare I say really difficult, and they often have a different, I guess the word I would use is demeanor or face that they have with receptionists versus GP. So I'm a GP. I love my patients. They all come in. They're all super nice. The same patients might go and see my reception and might be difficult, and the reception might say, actually, they were a little bit difficult regarding the thing. And I think, oh, Mrs. Smith, she is lovely. I couldn't ever imagine her being difficult. But that's sort of something to keep an eye on. Oh, and let me just double check. Am I sharing this whole thing correctly? It says it's sharing the PowerPoint window, not the full screen slideshow. Let me fix that up again. Let me share the whole entire screen and do that right now. And this should be much better. How is that? Is that a much better screen? Sorry, my apologies. So they're the main reasons why practices are sort of exploring AI receptionists. The other one is after hours. So it's really easy to call in after hours and say, hey, can I book an appointment? That's just related to the 24/7 nature of what we do. Not necessarily say that your receptionists have to be there 24/7. Of course, nurses, doctors, we all go home. But just having the ability to book in, check when an appointment is, check if there was anything that I needed to bring for that appointment. I booked in for an appointment with my nurse to get a vaccine. Do I need to bring that vaccine? Do I need to bring that polio injection? So a little bit of patient expectation and digital convenience just makes it easier to do these things over a 24/7 period. So having an AI receptionist that can do them is helpful. The other thing, this is a tricky thing to talk about, and that's cost pressures. We all know there's a lot of cost pressures in the context of general practice. The government, doesn't provide a huge amount of funding. The funding that is provided towards a GP consult not only has to pay the GP, but it has to pay for everything in the practice. So that humble 23 at 80, 90, $100, whatever you charge, of which 2/3 go to a GP. The last 1/3 needs to cover reception costs, computer costs, AI costs, electricity, so on and so forth. So there is a lot of cost pressure within general practice. There is this ability with AI receptionists to automate, I want to say, low value tasks. Not that they're low value in that the people doing them are of low value, but some of these tasks, if we can automate them, we can shift our receptionists to doing higher value tasks. So, for example, if we can pull away all the very simple bookings from our receptionists at our clinic, we can concentrate on booking high value things. So care plans, health assessments, ensuring we've got appropriate follow-up of things, etc. If we just take away that one thing, which is just booking standard appointments, that makes it easier to do those high value tasks. So what is the regulatory and legal landscape of AI in general practice? So this is just general AI. So not necessarily AI receptionists, but AI receptionists are a component of AI in general practice. So there's the ARPA, or the medico-legal responsibility. So the practitioner is responsible for scribe output. So that's specifically scribes, not AI receptionists as such. We have a Privacy Act of 1988. So we've got regulatory and legal rules around data collection, consent, and disclosure. So the idea that if you are having an AI involved with any sort of context or consult with a patient, there needs to be consent. So the patient needs to be aware that AI is involved with this. So the practical implementation step of that is when you call a medical practice, calling and saying, I want to book an appointment. Whoever answers that usually says something like, hi, I am, Jane from this practice, how can I help? If you've ever called, like Telstra, any of those big companies, they'll usually say something along the lines of, this phone call is recorded for, privacy and training purposes. And if you keep on the phone call, that is an implied consent. So just being aware that when the patient calls, if you're using an AI reception, that your AI receptionist should say something along the lines of, this is a virtual receptionist, or this is an AI receptionist that is helping out today, or something like that, in the context of disclosing that to the patient. Health Records Act, so this is state specific. There are different state specific rules around confidentiality. Just be aware that if you're using AI Scribe has some rules. AI receptionists have a separate sort of rules depending on if they're accessing health data. So as a general rule, human receptionists, I'm using that word again, human receptionists, AI receptionists probably would not access ideally any, or not many, health data. It's usually name, date of birth, booking in appointments. It's not a full-on conversation about how to manage that patient's diabetes, because it's not a clinician. It's a receptionist performing a very vital role of general practice, but doing it in a way that they are only having the information accessible to them that is relevant to do their job, which is usually just demographic type data. So again, an AI receptionist would only have access to demographic type data. This is something that you would check up with your vendor. So it's part of this checklist, which I'll put in the chat later. And then TGA. So TGA is therapeutic goods. They regulate anything that is therapeutic, so might have medical relevance. There are some AI that might become regulated as a software, as a medical device. An AI receptionist wouldn't generally, and I use the word generally, wouldn't generally fall under that umbrella because it is not a clinical tool. It is simply a booking in tool, but just be aware that there might be some AI that may become regulated. So it might be not regulated now, but in the future it might become regulated. There would be additional compliance concerns that you would need to keep update with in the context of software as a medical device. So again, AI receptionist would not come under that as a general rule, but just being aware that this is one of the many regulatory and legal things which we'll touch on in the next couple of slides that we need to consider. So compliance is a shared responsibility across the clinic, the vendor, and the staff. Even if you're taking away the AI receptionist, there are still these compliance and regulatory and legal issues that you would still need to follow with human receptionists. So it's very much the same with AI receptionists. So I've divided up into sort of, I guess, 3 pillars of medico-legal risk. So these are the things that I'm thinking about when I'm putting in a AI receptionist. So consent and transparency. So patients should be informed that this is an AI involved with this conversation. So when the patient calls up, the AI will say something on the lines of, I'm an AI, I am a virtual receptionist, I can help book this appointment, but if there are any questions that I can't answer or I have difficulty booking your appointment, I will transfer you to a human receptionist. So something along those lines. It doesn't have to be exactly in those words. So just being aware that the patient, needs to be informed they're an AI. I think that works both from the context of, regulatory requirements, but also reputation. So you can see on my slide, just quickly jumping forward to point 3, I've got here reputational damage. So reputational damage isn't necessarily a medico-legal thing, but it's something to very much be aware of. Yes, there could be an issue with your AI receptionist, which is 100% the fault of the company you bought it off. But who are the patients going to say, oh, this company's tried to outsource this and it didn't work very well, and now my health data is all on the internet or something like that? It's going to be you as the clinic. So just being aware that the reputational damage, even though it doesn't come under any sort of legal regulatory framework, it's just something to be very aware of when implementing these things. So patients being informed, that's very transparent. That's a good thing to do. Privacy and data security. So obviously your data is going to be very secure, stored in a secured manner. Again, ideally, most AI receptionists that are probably going to be integrating with your practice management software, so Best Practice, Medical Director, Genie, ZMed, etc., whoever you use, the data is likely going to be stored on their platform. The AI receptionist is very likely just going to be accessing the data, using it to confirm or identify the patient is going to be booked in, but not storing it. Similar to AI scribes, and again, speaking in general terms, but all AI scribes in Australia would generally not keep recording. They would not store that anywhere. They would get deleted straight away. An AI receptionist would work very similar. Like AI scribes, where the transcription is kept. So your GPs might look at the transcription of a consult. AI receptionists can also store transcriptions. That might be used for training purposes, where you look back at a transcription. So an AI receptionist is talking to a patient, and the patient actually said something that should have been triaged or put through to the ambulance. I have chest pain and it's really bad, as opposed to, okay, you have chest pain, I can book an appointment for you in a week. That's an issue. So that could be used for training for your staff, whereas recording voice is not something that any AI scribe that I'm aware of does. Certainly not us at MBS Pro, and certainly not any of the major players, but AI receptionists would work in a similar manner, in that the data storage would be very, very minimal, because all of it should be on your practice managed software. Encryption, being aware that encryption is important, of course, at rest and in transit, and Australian data hosting. Again, just jumping back to the practice management software, all the data is probably on there that is being accessed, and therefore is probably already stored in Australia. So just being aware of that. A little, I guess, sort of hack here would be an AI receptionist that is integrated with your practice management software. Practice management software, so for example, we're integrated with Best Practice. They have their own set of rules, regulations, which abide by all of these Australian privacy principles. If you're having an AI receptionist that is integrated, it is likely that they have abided by a lot of those things. Again, you got to make sure that you do your own due diligence, but it's very likely that they have data hosting encryption that is at least comparable to any sort of Australian requirements. Accountability and indemnity. So just being aware of medico-legal responsibility of data breaches, that's a big sort of risk to mitigate. being aware that yes, there can be a data breach with this vendor that has an AI receptionist, but the reputational damage is going to be with your clinic, even if you can prosecute in court and things like that. Now, that all sounds very scary, but unfortunately, it might be the reputational damage which can be really problematic to a small GP clinic in a small town, for example. So just being aware of that. So one of the key things that I would do is I definitely do, and we'll talk about this in the next couple of slides. Definitely inform your own MDO of what you're planning on doing. Do you have insurance that would cover those things? For example, I'm with Avant. They have cybersecurity insurance, which I'm pretty sure is included with just our practice ownership. I don't think it costs any extra. I think it was included. So just being aware that there are medico-legal responsibilities, and therefore having insurance, not a bad idea. So consent disclosure. So introducing a clear disclosure message. So, this call is going to be managed by an AI receptionist. You may speak at staff anytime. It might also be in the context of a patient calls in. It's 9 o'clock, super busy. There's 10 patients in the queue. There might be a message that plays and says, if you would like, you can press 1 and be diverted to our AI receptionist who can book an appointment for you, straight away, immediately. And that is sort of implied consent in that, if you press 1, it's implied that you're consenting to, chatting to the AI. And then there's explicit consent. Now, this is more in the context of clinical information. For example, I'm talking to a patient as a GP, and I have my AI scribe running, and I say to the patient, I am using this AI scribe. It will summarize our information and anything we discuss. Obviously, we are going to discuss clinical things because I am your GP. So that is an explicit consent, and you might get a form signed, things like that. Whereas dealing with a name, date of birth, and implied consent, reroute, press 1 to talk to your AI receptionist who can book you in straight away, might be an easy way of doing that call. Privacy and data. So these are some common sort of things to think about. So are the recordings stored? So AI scribes don't. All the major AI scribes in Australia don't record, don't store recordings. They will store transcriptions, which is the documented text from a conversation, not the voice. I heard a scary story one time, which I'll tell you. I was talking to another practice owner who was trialing some different AI scribes, I think about 18 months ago, 2 years ago, so like super early on. Very forward-thinking practice owner, which is awesome. But they tried an AI scribe from I don't know who it was. They didn't tell me the names, but from someone, not a major one, that they were using in their clinic, and they had some issues with the scribe. And so they called up the people. I'm having some issues. It's not so accurate. There's a few things that I said here. I said the patient had a broken leg and it missed it, and then the vendor said, oh well, I listened to the recording and you didn't mention there was a broken leg, so that's probably why it wasn't in there. So it's like a big no-no, like super no-no. Recordings, big issue. Don't store those. Transcriptions, a lot of AI scribes will do that and do that for a certain time. Same with receptionists. Not storing recordings is a great idea. Another thing to just be aware of, and again, I would say that no major models, major AI receptionist providers or AI scribe providers would ever do this, which is using data for model training. So using the data from a consult, using the data from an AI receptionist call to train your model, that's a big no-no as well. And then weak encryption. So not encrypting the data at rest, not encrypting it in transit, not storing it in appropriate areas, not having access to the minimal amount of data needed to do its actual job. An AI receptionist definitely does not need access to your clinical database to do its job. It can have a look at names, date of births, and addresses, phone numbers. That's pretty much all it would really need. So having a think about sort of mitigation strategies. So for example, using Australian-based servers, you might have some Azure servers in Sydney, encrypting your data at rest and transit. So these are things that you can probe to the vendors that you're discussing with about your AI receptionist. There might be audit logs and regular privacy impact assessments. So these are the things that the vendor could provide you. Do you have audit logs to show that the AI receptionist is doing what it is meant to doing? Obviously, if you engage with an AI receptionist that never books in anyone, that's a problem, because it's saying, yes, I have booked in these patients, and it's failing to do that for whatever reason. That's a problem that we would want to know, and therefore having audit logs is an important part of that. And privacy policies. So having privacy policies that align with our Australian privacy policies, so APP, and our Australian sort of data regulation rules, etc. So being aware of the Australian context, which is different to other overseas contexts, there is going to be and will be a ton of AI stuff from America. Of course, that's where a lot of the large AI scribes, AI large language models sort of exist. So just being aware of things that come from America. I'm positive they're great products, but just being aware of our own privacy and data security rules that we have in Australia, which are specific. Now, accountability indemnity. So liability or liability majoritatively in the majority remains with the practice, and also in the context of reputation. So this is something that you'd want to look at in the context of contracts. So review contracts. Where does the liability remain? Where is the indemnity? Where's the data ownership? What are the warranties? We talked about reputational damage. So yes, the vendor could be at fault. But it's your little clinic that'll probably pay for it. So just being aware that you're with a trusted provider of AI receptionists, notifying your MDO so they can confirm your AI coverage under indemnity. We have cybersecurity insurance with Avant, but I'm sure any and all of the other providers. So just being aware of how the liability works, if anything's indemnified, notifying your MDOs as well. So here are common risk scenarios that just being aware of when you're having an AI receptionist. And really reading through these, it's actually pretty similar to what would probably occur with a human receptionist. I know with my practice, we train up our receptionists. We talk to them about triaging calls. So a patient calls in and they say they've got chest pain, tell them to go to the hospital. If a patient calls up and says, I need an appointment in the next couple of days because, I've got a bit of a cough, but I'm not feeling so great. That's something that probably needs to get booked in before someone who says, I just need a routine checkup for diabetes, which could be booked out in a week or 2 weeks or something like that. So being aware of escalation. Now, as I mentioned before, our receptionists aren't really there they're not really there to triage. They're not, doctors, they're a computer, but just being aware that the AI can pick up on something that is urgent. So I call up my clinic, I've got chest pain. The AI should be able to say, if you've got chest pain, you need to go to the hospital. You need to hang up, call the ambulance, go to the hospital. Exactly as we would tell our own receptionists. Booking errors. This is a big one. There's two issues with this. There's the business risk. I was booked in and now there's two people that have turned up because only one person was actually booked in. The other person we thought was booked in, but they weren't. That can happen with, human reception as well. Absolutely. So there's the business risk. Obviously we want to run a profitable business and that means we need to have patients booked in. But there's also the clinical risk. I thought I was booked in for that thing that was important, but I wasn't. I didn't get my reminder. I didn't get a text that said I was booked in. Therefore, I missed out on this, medical treatment, and this is all your fault. So just being aware of, booking errors, so having an error rate with any of the vendors that you're checking out, and obviously that business context as well, billing issues and things like that. Recording without a consent. We said big no recordings without a consent. You might have in your phone call, this is an AI receptionist. This recording is, and this call is recorded for training purposes. Getting consent is perfectly okay, but just be aware of recording without consent. A big issue. The other one is misidentification. So this is something. AI is sort of a paradox. This is something that AI can do really, really well. AI can talk in multiple different languages without the need of having to swap over. So you can just do it like instantly. You don't have to say, "Hey, I'll call in this other receptionist who can speak, Mandarin." The AI can pretty much just do it straight away. However, there are still issues with things like accents. Speaking between two different languages. So there might be some familiarity with, Spanish and English, and they sort of combine a bit. I have family members that speak Spanish and English, and it sort of comes out, I think the word they use is Spanglish. So just being aware of that, and AI picking up on those subtleties could be difficult. It might misidentify a patient and it'll book in, Jane Brown instead of John Brown. So just being aware that that can happen. Now, all of these things can happen with, human receptionists, of course. So it's about the models, the training, the integrations with your practice management software, and then just being aware that there probably will be some errors. Nothing is 100%, but what is a way that it can be tracked? There can be audit logs. Everything can come together to improve, this in the context of your practice as well. So a governance framework. This is something that I think is not a bad idea. So this is sort of my own thoughts. Very, very happy to hear any sort of questions or thoughts on this from anyone else in the talk. When you're implementing any sort of AI in your clinic, it might be worthwhile, talking about it to the people that are going to be affected. So an AI scribe generally was pretty limited in that it only affected, the GP and the patient. So that was pretty straightforward. The GP could sort of decide if they wanted to do it or decide they didn't want to do it. And that's pretty easy. That's easy. But when you have an AI receptionist, that probably is going to be involved with multiple different groups of people in your practice. So reception, admin, practice managers, probably GPs in some context. I mean, certainly if an AI receptionist is, double booking every single consult, your GP will know about it, and they'll tell you about it. So being aware that's going to affect a lot of different people, having them involved with the decision making behind how it's going to be implemented, just being aware that it is or could lead to significant productivity gains, significant streamlining on workflows. So, for example, you could have an AI that immediately calls up people that are due for their health assessments, care plans, books them in. As a GP, like if I was a GP, I'd be like, that's fantastic. I can get all of my appropriate chronic disease, management items booked in. That's awesome. But I need to be aware that it might not do that 100% of the time. It might be 99% of the time really good, but just being aware that it might not work 1% of the time. And I, as the GP, will need to talk to the patient and say, sorry, this AI didn't work. This is the reason why. So involving all those people, documenting your AI use policy and limitations. So having an AI like framework or policy in your clinic, how it works, things about consent and disclosure. You might have things that you give to your patient, so documents, give it to your patient. This is what we use it for. You might have a policy that is available even on the phone. So a patient calls in and they can hear like a verbal policy of, how things work in your clinic. You might have escalation protocols for uncertain cases. So here's another example, with our AI receptionists that we're developing, or with AI receptionists in general. I'm sure a lot of people are probably doing something like this. Having a human person, I know that's a weird thing to say, but having a human person overseeing any sort of escalation protocols, escalations in real time. So a patient transcript can be reviewed with the AI receptionist, and then it can be looked at and said, oh, actually, this patient said they had, terrible chest pain. Let's have that flagged, and therefore can be reviewed straight away by a human receptionist who can correct any sort of issues that might have occurred because of an AI error or something like that. So having a really easy and open disclosure framework built in to not only the AI but your governance framework as a whole is really important. So you're reviewing your accuracy, reviewing any sort of biases and security regularly. That might be in the context with your vendors, with your IT providers, or probably both. So implementation checklist. So I've got a checklist, which is a fair bit longer than this. So this is sort of in a short framework, which I'll put in a document and put it in the chat. So you're going to define your clear use case. So it's very likely that if you are looking at implementing AI receptionists even now, that it's probably not going to do 100% of what your receptionists do, and book things in with your nurse and your GP at the same time, because you sort of book across columns in your best practice, or it might not be able to know that one of your GPs does work after hours, but only for phone calls, not seeing patients in person. Last thing you want to do is book in-person appointments up until 9 p.m. when your GP is happy to do phone calls but doesn't want to see patients because they're actually at home in their pajamas. So just being aware of what is the clear use case, what is specifically it going to do, and I'm going to show you some workflows later that'll give you an idea. Doing your due diligence with your vendors, so data storage, APP compliance, integrations with your favorite PMS is probably going to be a big plus. Conducting a privacy impact assessment, so what sort of assessment is this going to have on my clinic? Also really consider the reputational assessment. This is probably similar if anyone has overseas receptionists on their clinic team. There is likely, or you probably likely have done a privacy impact assessment on that if you're using overseas trained receptionists. This is a similar sort of framework to that. Training staff on AI scripts, so your staff can answer any questions. The patient walks in, I called the clinic and there was like a computer that answered it. What does that mean? Your staff having an idea of this is what it means, this is what it does, this is how we monitor it, this is how we ensure that it is working well. Updating your privacy statement and website disclosure so that your patients are aware that you are using those things. They collect data in such a way, they only utilize data in such a way that you don't have access to health data or whatever, etc. And then running it as a pilot, collecting feedback. So just being aware that different AI receptionists are probably going to have positives and negatives. It's unlikely that it's going to get your use case right like immediately straight away. There will be a fair bit of trial and error in the context of getting your knowledge base right, getting your prompts right, learning what your clinic does and the way that it works. So I'm going to show you a really great workflow for our clinic that we've done, just so you're aware, sort of an idea of what it does. So preparing your practice for an AI. So we talked about the governments having a policy framework, having a lead person, regularly reviewing the system, and then just remembering that, compliance, it's not just about the legal aspect. It's, it's preserving the patient trust. It's reputational. It's important in the context of, reputation. So I've got one of my helpers here. It's AJ from ASAP Telecom. So I think he's on the line, but I'll get him to jump in a second. We're talking about like how do you actually set it up? So from a patient point of view, ideally something like this would happen. They would call the clinic. You would have your AI reception call answer. It would be very coherent, make sense, and it would be able to do exactly as the patient wants it to do. So that's like an optimal, perfect world scenario. I call up, I just want an appointment with Dr. Smith. I'm booked in. That's the extent of my call. It's like a 30-second, 1-minute interaction, right? But there are a lot of things that can, I don't want to say interfere, but it just, there's a lot of things that can cause little hiccups along the way. So one, how you do the routing. So is it going to go to the AI first? Is it going to go to a human first into a queue, and then you might route back to the AI? So they're things to consider. 2, your internet reliability. So in the context of, do you have good internet? Do you have any, redundancies in terms of your internet? So do you have 2 lines? Do you ever have at times when the internet just drops out? That's a problem. Encryption standards, so just being aware of those. The other thing is being aware of the integration with your practice management software. That integration, I think, is a really important part. That's how the AI knows when it can book an appointment, because you have slots available at 12 o'clock with Mr. Smith again. That's how it knows when to book it. Retrieving that data from the database from the practice management software can cause some latency. So latency being the time it takes for the patient to say, I want to book an appointment at around midday on Tuesday, and the AI reception talking back to the patient and saying, oh, I don't have any appointments then. It might take a second to think, depending on how it integrates with your practice management software. So this is some of the things that you might consider with that infrastructure. I'll just do a little call out. Are you there, AJ?
Yes, I am.
Oh, he's there. Boom. It worked exactly as I planned. Was there anything else that you wanted to add to that? Because AJ from ASAP Telecom, a bit more technical minded than I am. Anything else that you would think of in terms of the infrastructure? Is there anything I'm going to be aware of in terms of like remote desktops? Does that change how it works? Anything related to our phone call system that I should be aware of from your point of view in your experience installing these AI receptionists at other clinics?
Not specifically. So with every different company's got a different way of deploying their AI from a clinic perspective. Some have more involvement and will have to play around with your server and stuff on site, which then there's a little bit more of a headache and possible risk to take into mind or into consideration. The way yours has been set up, it's a very simple workflow for most telecom providers to support. It's just diverting the main number to an external phone number that will be provided for their unique receptionist. And I would recommend putting an IVR in place. So the structure would be main phone number going to an IVR, which is an IVR's like, just think of a menu. Press 1 for this, 2 for this, 3 for this. So you might offer the call as, thanks for calling Condomine Medical Center. If you're mad at emergency, please hang up now, call 000 to get your compliance underway. And then you might say, if you want to skip the queue and speak to our automated booking system, please press 1 now, which will then send the call off to the AI to handle the call, or continue to hold and you'll speak to our reception team, and they'll go into the normal queue and the normal flow that you have in place for reception to answer the calls. When the AI will theoretically, if it can't handle the inquiry or the caller, requests to speak to a human being, it then sends a call back to the main group where the reception will answer the call when it's their place in the queue. So it gives people a chance to bypass the queue from a time perspective, usable after hours, and can route back to a voicemail if you have that on, anything like that. But the structure itself for setup, if you're on a cloud system, is very, very simple, and it can be done in most cases 10-15 minutes tops. It's more or less on the side of making sure you've got messaging in place, how in depth you want the workflow to be, how you want the calls transferred back to you, if you want SIP headers to give you notations on, whether it's passed on by the AI or a separate queue to label that it's come back from the AI, so you know this caller has spoken to the AI, wasn't able to be assisted, and you can handle the inquiry a little bit better. If you've got an on-prem system, slightly different for the workflow. On-prem system being an LG IPEX, Avaya, Samsung, Panasonic, whatever it might be. There's a little bit more nitty-gritty with the programming for that, but it's still very achievable. But if it's something you're looking at doing and you want to know how it would specifically work with your infrastructure, if you reach out to Casey and his team, I can get myself or one of my techs to just answer any questions you might have. And if you need support with your provider implementing it, we're more than happy to help guide them with the support as well.
Yeah, awesome. Appreciate it, AJ. So that's AJ from ASAP Telecom, sort of one of our partners at MBS Pro with how we implementing those. So just being aware of the implementation, like all AI, I suppose, implementation is key. Getting it set up in a real natural way. It works with your workflows. So I'll chat about a few other things just in terms of like maybe a slightly clinical context. After hours triage and AI. So how does it work after hours? So one of the main really important aspects of the whole idea of AI reception is that it can take phone calls when no one's actually at the clinic and book people in. From a business point of view, that's great. I want the ability to fill up my books even if no one is at the clinic to answer phone calls and fill up the books. But there's also an element of risk. How can someone check up to make sure that the AI is doing what it's meant to be doing and not giving clinical advice and doing things that we've told it not to do? How can I do that if no one's in the clinic, no one's overseeing it? There's a couple of things. So one is just putting in really clear guardrails. So this will be part of your implementation when you actually get the AI. You'll have a knowledge base. I think I've got a picture coming up and I'll show you what it looks like. So a knowledge base essentially is where you put in when you're open, what sort of things your doctors are interested in, diabetes, antenatal care, whatever, where the parking is. You have nurses and pathology and pharmacy on site, etc. So as part of your knowledge base and as part of the AI prompt, there is this guardrail. So guardrails, these are the things that you can do. These are the things that you cannot do. Regardless, of course, having guardrails on the AI is all well and good. But how many times have you talked to your human receptionist and they've said, I've said to Mrs. Smith, I'll book her in for an appointment, and she's told me that she has terrible, hemorrhoids or something like that. These things sort of happen. So you can train your AI as much as possible and put guardrails on it to not give clinical information, but eventually a patient's going to drop, something on them. So how can you have a system that deals with it, can deal with it after hours, can triage the patient, can refer back to the ambulance appropriately, and can refer on to, for example, you might have an after hours on call service, either with your own GP clinic or with a deputizing service related to your clinic. So an after hours, hello home doctor, something like that. So how can you have a system that connects across those ways? And this is where chatting with someone like AJ is really important, because you might have another diversion. So a patient says, I've got chest pain and I'm not calling the ambulance. I want to come into the clinic. It's like 2 o'clock in the morning. So your AI might have a way to triage and say, that's okay. I think calling an ambulance is a good idea, but I have Hello Home Doctor who can give you a call right now. I can connect you to them. They'll call you and walk you through your symptoms and whatever else. And it might be, I don't actually have chest pain. I've just got really bad anxiety. But you don't want your AI making that call. You want a human doctor making that call. So there are ways that you can connect it up with the systems that we currently have in place to ensure that triage service is not falling on AI, but falling on people, and working really well to connect those systems. That can help improve access for rural and low resource clinics, where you might have demographic of patient that don't have the ability to go to a hospital at certain times, but we might be able to connect them to in-home doctors and things like that. Remember, AI doesn't replace clinical judgment or even just human judgment. It doesn't replace any judgment. It can do tasks that are pretty straightforward and do them really, really well. So repetitive tasks, remember we talked about the 80-20 rule. So booking in patients can do exceptionally well. Rescheduling patients, rebooking patients, things like that, fantastic. Liability remains with the supervising GP in the context of an AI scribe, or with the service in the context of a AI receptionist. The system should not be making any sort of independent diagnosis. If you're talking to a vendor and they say, yeah, our AI can, clinically triage, I would say really be careful with that. Remember, we talked about software as a medical device as something that's we've got to consider as well in the context of any of these AI. And then with your triage logic, you might have certain things that you do. So, for example, you are at an urgent care clinic, so you might actually be able to take chest pains because you can do the TROPS on site and things like that. So having a system that will recognize chest pain, either go straight to hospital because you don't have those services available, or come straight in and get seen straight away. This is something that we document in our knowledge base with our guardrails, and auditing these outcomes to ensure that it continually does those things. So some practical implementation steps. So before launching AI systems, reviewing your AI compliance, confirm Australian hosting and APP adherence. It's not meant to be one word, app adherence, APP, Australian privacy principles. Conduct a privacy impact assessment, training your staff in the way that it works so they're familiar with explaining it to patients. Clinical privacy documentation, and then just being really aware of patient feedback. Remember, reputation is an important context as well. These are some other things that I sort of thought of. So AJ sort of touched on them in terms of deciding whether your AI meets the patient first, or whether it's a message, press 1 for this, press 2 for this, or whether or not you divert it back to the AI once it's been in the queue for a while. You would need to decide what exactly you want it to do. Will it just book standard appointments? It'll do nothing else except standards, or will it do standards, long appointments, skin checks, care plans, health assessments? Will it book across 2 appointment slots, so nurse and doctor? Will it just take a message? Will it be not connected to your practice management software at all, and it will just answer questions about when is your clinic open, what is there parking available, do you have wheelchair accessible ramps and things like that? So there are some AI receptionists that just do those, and it will say, if you need to discuss about your appointment, press 1 and I'll divert you to a human who has access to the clinic book. This is an example of a call flow diagram. If anyone's interested in this, I'm happy to send it to you. This is my clinic. So what we did in terms of mapping out what we wanted our AI to do, we mapped out, I think someone's trying to join. Can I let that one person in? Let me just double check them. Boom, admitted. So everyone can get a go. This is our AI. This is our current flow diagram, not related to AI. I asked one of our receptionists to just map it out. This is half. You can see it's cut off down the bottom because it's like a huge diagram. There's 2 reasons why you might do this. So the first reason is actually not related to AI at all. It's just related to how can we document the flow, the workflows in receptionists, and how can we ensure that it actually sort of makes sense. I actually think the less, if we could compress all this, that would probably be better. So that's something that we're working on, outside of AI. But in the context of AI, you can document what your current workflows are, and then you might decide what are some things that an AI could do really, really well that would, reduce the burden on your front desk, but not necessarily add to the burden. So with our AI and the way that we're implementing it, we've decided it's going to be really good at booking appointments for existing patients because it can look at our best practice database. You can see the patients, is there, Mr. Smith, date of birth, and then it can book them in because it knows who the patient is based on the database. We've decided that new patients is something that we're going to add on after. The reason being is that I'm a new patient, but actually, they were here like 10 years ago and they're not a new patient. They're actually a patient that we've made inactive. Or I'm a new patient, but I don't want to pay your initial booking fee. Or a new patient, I'm only going to come there if I bulk bill, and who's that doctor there? So we've decided that new patients, fantastic, awesome. But it might also be, again, a way that we can provide a really great service to them. They can get diverted straight to, say, a human receptionist. Well, existing patients who are very familiar with how it works can book straight in through our AI receptionist. So that's one of the workflows that we've decided to do straight away. We've also thought that, for example, when other medical professionals call, there will be a way that they don't talk to an AI receptionist. Obviously, if a doctor is calling up from the hospital for, a recent health summary or a medication list or something like that, they don't want to be listening to AI asking what's going on. But think about this in the future. What about if the AI had access not to the clinical data, but had an easy way of, calling and pulling that information and then just emailing it off straight away. That's something where AI might go to in the future in terms of AI receptionists are really streamlining that workflow. But currently we've just said, let's just do existing patients. Let's just do standard appointments. So standard long appointments. And we're going to do that first. Next, we're going to do repeat scripts, skin checks. And then after that, we'll think about health assessments, care plans. It depends on your workflows of your other items as well. So for us, we do care plans just with the GP, and therefore booking an appointment for a care plan through an AI reception is actually, not too hard. But our health assessments, they run over a nurse and GP appointment because, we utilize the nurse time towards the health assessment. And therefore that booking would be a little bit trickier because it's now going to book over two things. So you got to make sure those things, you don't want to book with appointment at 9 o'clock in the morning with the nurse, and then you've got a 5 o'clock appointment, with your GP. So just being aware of how that works is sort of a, funny sort of thing just to be aware of in terms of when you're first initiating them things. So other things I've thought of which I think are worthwhile in terms of reviewing. So reviewing your demographics. So there actually probably is a really great use for AI receptionists if you're in a multi-language, demographic place. It might be less useful, for example, if you're a lone aged care doctor, you just work in the nursing home. Or you might think of some really good workflows where it actually might be really useful, where family members can call up and it will not triage clinically, but it'll triage the family members and say, I take phone calls between, 4 and 5. If this is an emergency, call the ambulance, but otherwise you can leave a message. So just thinking about your specific demographic and use cases, reviewing your AI policy, reviewing your integrations. So I think, this is my conflict of interest or bias, having something that's integrated with your practice management system is probably going to be more useful. Mapping out your current workflow, so like that workflow diagram that I've showed, I think that will make it easier to see what's going on. Deciding on what specific tasks you could do. So booking standard appointments, booking repeat scripts, rescheduling, cancelling, reminders, recalls, etc. So having a specific idea of what you want it to do and the way you want it to work. Some difficult workflows, as I've mentioned before, so double bookings, anything that needs to be booked with the nurse and doctor at the same time. Skin cancer, for example, there might be a specific requirement. So I need, half an hour to cut this out, or I need 20 minutes, or I only need 10 minutes. That might be different for each doctor, and therefore initially that could be a bit tricky, but you can see that once you've got it integrated and it's working well, an AI would actually do that really well because it knows exactly what needs to be booked for each doctor for each procedure, and it can do it automatically. And it's not something that needs to be trained and reminded like a human receptionist. It will just know because it has access to its knowledge base. Health assessments and care plans if involving nurses, vaccine clinics, things like that. So they're workflows that might be a little bit tricky. Other things to be aware of. So I've said in the future, this is in the very near future. So just having analytics. So analytics of, when are the calls coming in? What's your conversion rate? So how many calls do you get versus how many appointments are made? How many errors are occurring? What's your distribution between each doctor? Costs involved with AI. Of course, an AI reception, super cool. It wouldn't make sense if it costs more than a human reception, though. Human receptionists do a fantastic job. An AI receptionist still going to do a great job, but if it costs more than a human receptionist, you're just going to go with a human. So they've got to be understanding of the costs involved of having it. This is something I think will look really cool in the future. So rescheduling, doctor calls in sick, happens all the time. Happened to me right now. I'm looking at my phone as someone is calling sick and thinking, oh, I have to reschedule those appointments. So having a rescheduling feature where it can just load up the database for whoever's booked in for that doctor for that day, and then just calling them, of which you can call everyone 100% at the one time, and then just reschedule what needs to be rescheduled. So a close. I know we've gone over time. We sort of said half an hour. Sorry. A couple of takes So transparency. It's all about building patient trust, accountability. Just thinking that there's a reputational context. Of course, your vendors are going to be in it with you. We have a vested interest in ensuring that we're offering a good product, but just being aware of the reputation. And so picking vendors that are going to work with you, really, really important. Implementing in a considered and concise and slow way with really specific workflows, and having a look back at auditing and last slide, and auditing any issues and improving upon them, because AI receptionists will be great. Let me just jump back here to answer any questions. AI receptionists are going to be great. They're going to change a lot of what we do, especially in general practice, help with costs and things like that. But just being aware with the issues that could occur. If any AI receptionist vendor says it's 100% not going to have problems, it's going to work perfectly, they're lying. So there will be things that will need to be worked through that will make it, better for your clinic. Exactly as you've rolled out your AI scribes, that will get better with time. So we'll jump on a couple of questions. I think I've got a few in the chat here. So this has all been recorded. So if anyone's missed out on it, there'll be a recording. We'll send it out. It's not a problem. If there are any questions or any clarifications, we are going to run a part 2 series. So we're going to be at the Practice Management Conference. We'll be showcasing there as MBS Pro. Then we're going to run a part 2 just to make sure everyone's over how these receptionists, how these AI receptionists work, and how they can be, really implemented well in your practice. So a couple of questions. Let me just go through them. So a quick cheeky question: which scribe do you use? We use MBS Pro. That's what we do. We do AI scribes that help with MBS recommendations. So that's the one that I use. Another question here. Question from one of our technical guys. So Amazon Web Services are having difficulties tonight, so a number of platforms are offline. Lucky we are on Microsoft Teams. Microsoft Teams is great, but I'm still getting used to it, as you've probably seen. Another question here: do you find patients were willing to opt for AI over human receptionists? Do you have stats on how frequently patients utilize the AI option? Did uptake on willingness to use AI gradually improve over time? Do you use an online booking system like Hotdog? So a couple of questions there. Let me run through them, and let me finish off that question. My assumption would be that patients who don't want to book online are unlikely or unwilling to use an AI receptionist. Very good thought. So we were discussing this exact thought with our leadership team at our clinic. If you have a demographic that have not engaged with two things, so your online booking platform, possibly your kiosks. So if you have a booking in kiosk that sits near your front desk where people, type in on an iPad their, name, date of birth and book in. If people aren't engaging with those two things, it's a reasonable assumption to say that they wouldn't book in, wouldn't utilize an AI receptionist all that well. So there are two ways that we can sort of mitigate against that. So one, and this is probably not on purpose, but can happen. How long are your wait times for a phone call at 9 o'clock in the morning? At my clinic, it's like atrocious. Again, not by design and not because I'm trying to annoy people, but it can be really difficult to get through on the phone just by the fact that we have, can only 100 calls come in within an hour, and we've got like 7 or 8 receptionists, and I feel like that's a lot, like just purely answering phone calls. And then we have a couple more on the front desk. So willingness, I think most people probably would prefer to speak to a human reception, but most people would rather get their appointment booked without waiting for 10 minutes on the phone. We do have an online booking system. We use Automed. That's a good system. But we do have a particular demographic of patients that don't really like to use Automed either. So either like to call up, in which case we're hoping to capture them with our AI receptionist, or who will just come in and make an appointment. So we still have people that will come on, come in and sort of do that. So just be aware of that when you're first implementing anything. There's very much a change management strategy that you got to consider when you're first getting it. It's likely that a lot of people will prefer just to divert straight to human receptionists, but they'll get used to the way that the system works, just as they got used to online booking systems. So just being aware of those. So we don't currently have any stats on how frequent patients are booking in via the AI receptionist versus human receptionist. So that's something that we'll be updating with our dashboards and just letting people know. So which MBS Pro, which AI reception software are you using? So MBS Pro, we're developing our own. So we're showcasing that at Practice Managers Conference, and we'll follow up with a showcase. This was a general overview of AI receptionists and just things to look out for in terms of your vendors, your IT providers. We've heard from AJ from ASAP Telecom, had some really great insights in that as well. So just things to be aware of, because AI receptionists are definitely coming. They're going to change how we do general practice. So just being aware of them. So, but we've definitely got one, mbspro.com.au. Any other questions?
Sorry, Casey.
Yo.
I'm happy just to quickly touch on CAR's bit. So we look after a lot of medical centers, and almost every medical center within a span of 6 months of the ones we manage has started deploying all these different AI receptionists from many different companies. And in terms of the opting for an AI over human, it's very demographic specific, but it also comes back to the wording and how you sell it on convenience. I think if you give both options and present it, you're definitely going to notice a reduction in calls going to your reception, because people will opt for that for the sake of convenience and just getting it over and done with, especially if it's a good AI receptionist and can do its job very well. Because a lot of people come out with them, but they don't invest in them per se, so they don't work as well. So if you give, if you've got a good call structure, very clear, concise messaging, and you can sort of sell it in a way where there's a benefit to it and not just sending it off immediately, definitely. And then piece by piece, you scale it in a little bit deeper, and people get, more, I suppose, comfortable with the idea of it. I think the biggest pushback isn't so much about, you don't want to speak to a robot. It's you're scared to speak to an AI. When you think about calling the bank and handing out your details, it can be a scary thing. So as long as you've got a good reputation behind you, people understand that you're going through the correct measures to store it, and you can put information about that before it transfers the call. I think people will take on it very, very well. And I've seen statistics from different clinics that, I've seen a great benefit from implementing it. And these were in very mixed demographic areas. It wasn't, a set standard. There was a very mixed demographic between, nationalities and ages, and everyone's taken to it pretty well.
Awesome. Yeah. Thanks very much for that insight. So, another question here. Can we set up our own AI agents to dynamically adapt to our clinic, and can this change over time when it is required by ourselves? So certainly with your AI agents, you give it its knowledge base. What it can do with your knowledge base will probably change. One, with the models that are being used as they get sort of smarter and faster. Two, with the tightness of the integration of your PMS system. So, for example, MBS Pro, we integrate with best practice. We have access to some data. We don't have access to, all the data. And an AI receptionist truly, doesn't need access to clinical data, to work appropriately. But there might be some things that are clinical adjacent that might be handy. For example, reminders and recalls. Calling a patient and saying you have an appointment for this is something that would be, very handy in the future, and something that I think will come just as we all get used to AI receptionists in general practice. So any other questions, shoot me an email. It's on our website and I'll put it in the chat. Let me share this checklist with you as well. Got it right here. Excellent. I'm going to share it and put it into the chat right now. So it's just a checklist that you might look at in terms of the things that you will review when you're looking at your AI receptionist. So hopefully that's helpful. Jump on that and have a look. Otherwise, we will finish it up tonight. Appreciate your patience. We've gone over time. Appreciate your patience with me figuring out teams. This is all recorded. We'll send out a copy. Thanks to everyone for joining. Hope you have a good rest of your night. I'll end that event now. Thanks, everyone. See you later.